say glaucoma in children can happen. It can happen in newborn baby, it can happen in any age group from few weeks to few months to few years after the birth. The idea of having this meeting with the parents who have children who may be having glaucoma, who are having glaucoma, we treat it and they are coming here. In the clinic we spend some time, in the operating room we operate, in the post-operative visit we spend some time, but I feel that that is not enough. There is scope for discussing this problem because this is a situation which requires lifelong treatment, lifelong follow-up. And to create an awareness about this disease, we started an informal society for parents of congenital glaucoma or the childhood glaucoma. We meet every year, every day, every week we are having clinic. But once a year we used to have meeting of this kind, children along with the parents, so that we discuss the problem and we can really answer their queries, whatever we want to tell. For want of time we may not have discussed that detail in the clinic. So that's the idea, to create an awareness so that the disease should be treated as early as possible. If operation is required, operation should be done as early as possible, and repeated checkup, follow-up is required for all children lifelong. So that's the thing, and it's an integrated approach, integrating medical, surgical, genetic and rehabilitation approach, which gives the holistic care for the child afflicted with glaucoma. And whatever we do, a certain percentage of children will be visually impaired, mild, moderate to severe degree of visual impairment. And for those children, we'll have to spend some more time and refer the children to our Center for Sight Enhancement and Visual Rehabilitation, so that now daily living tasks, daily activities in the school, in the home, works related to study should be taken care of. Sometimes magnifying device, several optical and non-optical aids help, telescope, which can help a child to see the blackboard sitting in the proper distance. So sometimes this optical and non-optical devices help. But in children where visual impairment is so severe, practically that category we call the child is a blind child. By blind we do not mean that the child do not have any other potential. The child may be having very good memory, other physical disabilities are not there. So it's the question of taking care of the child, whatever deficiency the child may be having. The child may be otherwise very gifted. So we want to do things in a way that the child development doesn't suffer. For visual impairment, the study should not be suffering. The child can be educated with the Braille system. And in cases where there is multiple handicap, like the child may be having associated impairment of hearing, there we'll have to involve the people who are expert in that. So we'll have to take care of the child in a holistic manner. Along with that, we'll have to take the family members and the parents into confidence, so that we can give best possible care to the child, so that each and every afflicted child should be a contributory member or a useful member to our society. We, the so-called normal individuals without any problem, will have to accept that the person or the child who may be having some form of impairment, be it visual, be it intellectual or any other physical disability, will have to really take care of that afflicted person in the best possible way, so that the person or the child feels comfortable in the society. Sometimes the person or the child who is having some form of visual disability or intellectual deficiency, the society's response or the response of the so-called normal people towards that abnormal situation is very difficult or sometimes not acceptable. That's the reason we should be aware of that thing, and we should be able to do things so that the visually impaired people or the children who are having some handicap feel comfortable in the society, in the family. That's the message should be given.